Earlier this month, nearly 42 million Americans lost access to food stamp benefits during the government shutdown. Now, federal law changes mean some will lose full access to these benefits. The Supplemental Nutrition Assistance Program, known as SNAP or food stamps, provide monthly food benefits to low-income families to supplement their grocery budget. According to city data, nearly 3 million New Yorkers, or 1 out of 7, use SNAP benefits.
The majority of the SNAP participants are working families. They are just not making enough money to buy the foods that they need. For many, this is not a supplemental program. It's really the only money they have towards their household grocery budget.
Earlier this month, the One Big Beautiful Bill Act changed the requirements for able bodied adults without dependents to be eligible for SNAP. Now, able bodied adults from 18 to 64 who do not live with children under 14 must meet 80 hours of qualifying work to be eligible. This work can come from paid and unpaid jobs, volunteering, community service, or participation in SNAP employment and training programs. New exemptions include disability, eligibility for the Indian Health Services, and pregnancy. Annika Osterland's family received SNAP benefits until 2022. They started receiving benefits because her father's cancer prevented him from working.
Um, my mom told me later, much later, that like she would eat peanut butter and jelly sandwiches every single day so that me and my brother could eat actual food. So I'm assuming that pretty much all of our groceries were paid for by SNAP if she was having to like restrict her eating. It wasn't abundant enough for the entire family.
In light of these SNAP changes, local food banks and pantries have tried to serve affected community members, including the Food Bank for NYC. But, as Stephanie Schumann, Director of External Communications, says, no hunger relief organization can fill the void of SNAP.
People on SNAP are often low-wage workers. They're often families. They're often people with disabilities. And what we heard from a lot from our network of pantries, and I can give you a specific example, they're seniors and they're veterans. It's a leg up, a helping hand when they need it most. And unfortunately, the misconceptions on the fraud are that SNAP works. Emergency food systems like ours cannot replace those social safety nets that are just vital for the well-being of people all across the country.
Food policy researchers like NYU professor Angela Trude say vulnerable communities will be most impacted by SNAP changes.
Research shows that with a stricter work requirement, we see a disproportional impact on enrollment by among individuals with disabilities and also among Black and Hispanic communities. Some of those requirements we will see a lower enrollment among different pockets of the population, and usually are the ones that need the most.
Attorneys general from 20 states, including New York, have warned the United States Department of Agriculture against SNAP changes. For many states, they will go into effect on December 1st. It's unclear whether these states will continue to challenge the federal government. Danny Biondi for NYU Now.